And that brings us to our very first presentation, which is Dr. Judith Morgan. She's research focused on the mechanisms for risk of affective disorders during early development. Dr. Morgan received a BS in psychology from the University of Alabama, summa cum laude, congratulations, and a PhD in clinical psychology from the University of Delaware in 2010. Dr. Morgan has received continuous funding from NIH Mental Health Institutes since 2013. She has been awarded a NIH-funded Career Development Award, a KO1, which are very competitive. Again, wonderful growth of a career trajectory. Neural and social processes of positive affect in children at risk for depression that examine neural forward function in 6 to 8-year-olds. Children at familial risk for depression. In 2017, she was awarded the Biobehavioral Research Award for Innovative New Scientists and received an R01 on evaluating affective behavioral and neural synchrony in mother-child dyads and how it may be compromised by depression. Most recently, she has received 2 additional R01s. And folks, R01s are highly competitive. It just speaks to the rigor of her science. In February of 23 to evaluate biobehavioral synchrony in mother-infant dyads affected by postpartum depression, and another in 2024 to experimentally test how parental socialization of child-positive affect may shape child neuro-reward activity. And the title for today's talk is Caregiver-child Biobehavioral Synchrony in Positive Contexts. So welcome, Dr. Morgan, and I will stop sharing. And there we see your screen and it looks great. And yes.
Awesome. Thank you so much, Monica, for that wonderful introduction. I am so pleased and honored to be here today to share my work with you guys. And I'm so grateful for this invitation to kick off the series. As Monica described, today I'm going to be talking about caregiver-child positive biobehavioral synchrony. So to start off with giving you a framework of today's talk, I want to begin by defining what synchrony is, what does it look like, why is it important, and what might disrupt synchrony in caregiver-child dyads. I will be doing that in the context of evidence that's already been published in the literature over the past few years, as well as some findings from 2 grant-funded studies of my own, the BRIGHT study and the PAIR study. And then I'll end with some clinical implications of this work, how we can use this information about synchrony to help families. Okay, so what is caregiver-child synchrony? To make sure we're all working from the same definition, caregiver-child synchrony is defined as dynamic and temporal coordination of relational behaviors, affect, and physiology within dyads. It's observable in various types of dyads. In the research world, it was first observed in animals, specifically mum and pup dyads of rats. And we've also looked at it in humans, in romantic partners, and most relevant to today's talk in terms of caregiver-child dyads, particularly caregivers and their very young children, infants and toddlers. We think of caregiver-child synchrony as a measure of child and caregiver co-regulation, or the ways in which the 2 dyad members adapt and attune to their behaviors in response to one another. Or it could be a measure of co-dysregulation in terms of contexts in which one person may be experiencing high levels of negative emotion or other types of negative behaviors, and the other dyad member starts to match that. In this regard, synchrony may be a developmental mechanism for how children learn how to regulate their own emotions and get along with individuals outside of the dyad. For us to understand how synchrony could be a developmental mechanism, I'd like to take a step back and think about the broader parental socialization of emotion literature. This work has really been driven by pioneers in the field: Nancy Eisenberg, Tracy Spenrad, Amanda Cumberland, and Amanda Morris really put together this model of parental socialization, and that it's comprised of 3 components: the ways that caregivers react to children's emotions, how they discuss emotions, and how they express emotions themselves. So in terms of reaction to children's emotions, that's the way that the way that caregivers respond to children's emotions, and that could either encourage healthy emotion expression or discourage it. So some supportive reactions that you would likely see within a dyad would be a caregiver celebrating with the child when they're experiencing joy, or staying calm when the child is sad or angry. Whereas a reaction that would be non-supportive of child-regulated emotion would be punitive responses, or ignoring or dismissing the emotions altogether. Discussion of emotion are the ways in which caregivers talk about emotions in everyday life, either when the child is having an intense emotional moment or during neutral, calm times. So, a way of discussing emotions that would be supportive of healthy child development would be to label the child's feelings in the moment. I can tell you're really mad right now. You wanted that cookie, and I said no. Or talking about emotions in everyday life, even when things are calm, or about others' emotions. I was talking to grandma on the phone, and she's sad because she misses grandpa, as well as acknowledging and validating emotions. So it's okay to be sad. I feel sad sometimes too. Whereas discussion of emotion that would be thought of to be non-supportive would be talking about emotions in a negative light or not at all, or outright verbally discouraging emotions. Stop crying or don't be such a crybaby, as examples. And the last type of socialization that this model puts forward is a more implicit socialization component. And that is that the caregiver themselves serves as a role model of emotion expression. So this is a caregiver that expresses joy, love, and excitement in a genuine and authentic way. They may allow their children to see them experience periods of sadness, frustration, or fear that are well managed and regulated, using language to show them that I'm feeling mad right now. I'm going to go take a moment to myself. Whereas a non supportive expression would be unbridled rage, aggression, hostility, or on the flip side, grandiosity that is apparent in everyday life. So for us to kind of understand what does this look like, I'd like to show you this image of a mother and her very young child engaged in a interaction with one another. This would be a typical everyday experience that likely happens multiple times a day. And we can see synchrony at work here. We can see that shared positive emotion, and that they're both smiling at one another. They have shared gaze, and that they're both looking at each other in the eyes at the same time. There's likely some shared vocalizations that are positive, and that the baby might be cooing and babbling, and mom may be imitating those sounds right back to the baby. And so we see a lot of that serve and return, contingent affect and behavior that's positive in nature, that has been studied and talked about in the field of developmental psychology for decades. And when you think about socialization, you can see how all of those components fit in with that parental socialization model. The mom is responding to her child's emotion in kind, smiling back at the child, imitating the vocalizations, for example. We could picture, we can't hear it, but we could imagine certainly that she may be labeling the child's emotions. You're so happy today. And she definitely has this genuine expressiveness of joy and interest, delighting in her baby right here in this moment. That likely drives this interaction to continue and lengthen, and reinforces that type of positive emotion and positive behavior in her baby over time. And so this is what positive biobehavioral synchrony looks like outwardly. We see this shared back and forth affect and behavior, but quite interestingly, there's also synchrony going on beneath the skin. And that is that research in the past couple decades has shown that these types of positive interactions are also characterized by shared physiology. In particular, Ruth Feldman did a seminal study that was published in 2011, in which she studied 40 dyads of mothers and their 3-month-old infants that were engaged in face to face interactions. And what she found was that these mother infant dyads coordinated their heart rhythms with one another within lags of less than 1 second. And the pattern was significant in both directions. Mothers were synchronizing with their babies' heart rates, and babies were synchronizing with their mother's heart rates. And what was most important was that the concordance of heart rhythms was significantly higher during those periods of time in which the mothers and the babies were showing shared positive affect and shared positive vocalizations compared to more non-synchronous moments within these same interactions. So that physiological coupling was specific to the times of affective and behavioral synchrony. And what the study showed for the first time was that online biobehavioral synchrony is occurring in these first months of life by means of social contact and shared reciprocal behavior. Since then, other studies have replicated her findings, and what we have a picture now is what does biobehavioral synchrony between a caregiver and a child in positive context looks like. It's just, at the sake of being repetitive, shared positive affect, gaze and vocalizations, reciprocal harmonious behavior, that back and forth, serve and return, that synchronized physiology that I just described in terms of heart rhythms. So one question that I often get, and that many people who are thinking about synchrony are also asked, is synchrony always good? And the answer, of course, is no. Just like any type of socialization factor, synchronization in certain contexts likely does not support healthy child development or healthy child self-regulation. For example, if you think about a time in which a toddler is experiencing intense negative emotions, maybe they're in the midst of a temper tantrum or having some type of emotional meltdown, of course, the caregiver may be likely to feel frustration and tension themselves. They may be tempted to also express that negative emotion outwardly by yelling or speaking harshly. And we definitely would see with under the skin that same physiological coupling of that faster heart rate and that those cortisol spikes that come with negative emotion and tension. If that type of pattern were to persist across the interaction, we could think of that as co-dysregulation, in that the toddler's negative emotions, their difficult feelings would lead to mutual dysregulation in both members of the dyad. But if in this case the caregiver were able to take some deep breaths and calm their voice or quiet their voice, use soothing tones, perhaps, not always, the toddler would also be able to slow their heart rate and breathe deeply as well in order to calm themselves down. So in this case, matching the negative affect and the negative behavior would result in co-dysregulation, and we would not think of that as a beneficial process for child development. Other contexts would be dyads that are experiencing high levels of internal or external stressors. So if they're going through difficult life experiences, or if the parent is coping with psychopathology, we may not think synchrony in these instances would be beneficial as well. So a young child matching their caregiver's low mood, anhedonia, or anxiety may lead to dysregulation in the child themselves. Waters and colleagues actually found some evidence to support this conceptual thinking, in that they did a study with a sample of 69 mothers and their 12 to 14-month-old infants or young toddlers. And what they did was they initially separated the dyads when they came into the lab, and the mothers were randomly assigned to either do a stressful evaluation task or a non-stressful control task. And when the mothers and infants were reunited and interacted with one another, they found that there was this physiological coupling between mother and infant, and that they had similar heart rate reactivity. And it was especially for those dyads whose mothers had participated in the stressful negative evaluation task. They also found that the infants were displaying behaviors that suggested that they were stressed out as well. So we're seeing this physiological synchrony in stressful contexts that may be associated with mutual dysregulation in this study. So one question that I've had as I've started doing my own work is, what about the neural level? We have this observation of affect and behavior that we can see with our eyes between a caregiver and her young child. We have a couple decades of research showing that underneath the skin, in terms of physiology, there's this coupling as well. But if that's the case, there's likely also synchronization of brain activity between the parent and the child particularly in neural regions involved in emotion. So the ventral striatum, which is involved in positive affect and reward, the medial and the lateral prefrontal cortex, which are involved in regulation of emotions and generation of emotions, and the temporal parietal junction, or TPJ, which is a mentalizing region that helps us understand the ways that others are thinking and feeling. Due to neuroimaging constraints, to date, little has been known about how moment-to-moment positive affective synchrony may be related to neural synchrony in parent-child dyads. But there have been some recent advances in neuroimaging that have allowed us to start to test that. And that's where the BRIGHT study came in. So the BRIGHT study stands for Brain Response in Infant and Toddler Emotions. This was a study that I led starting in 2017 and was funded by the NIMH. And our main question was, do synchronous mother-child interactions elicit synchronized brain activity in mother-child dyads? And what I hypothesized was yes, we would see that greater moment-to-moment positive affective synchrony would be time-linked with greater neural synchrony in these dyads, similar to what Ruth Feldman's group found in 2011 with heart rate physiology. So to do that, we used a technology called near-infrared spectroscopy, or NIRS. This technology uses near-infrared light to evaluate changes in oxygen levels and blood flow. It's the same technology that many of you have likely experienced yourselves at a doctor's appointment or a hospital visit, the pulse oximeter clip that sits on your finger and looks at your blood oxygenation levels. In this case, the light is emitted through sources that are put inside a stretchy cap that sits close to your head. The light then goes in through the source. It can pass through the scalp, the skull, into the brain tissue, and then back out of the detector. And what we can do is we can calculate how much light has been absorbed so that we have a measure of brain activity. There are a lot of reasons why this method is advantageous for young children relative to other neuroimaging methods. Most relevant to synchrony, it's less sensitive to movement, and it's non-restrictive. So kids can sit up and sit next to their caregiver. They can interact in a normal, naturalistic way. They can play together. We can synchronize two systems so that we can look at brain activity at the same time in both dyad members. And it has greater temporal resolution relative to fMRI, in that we can really look at some of these fine-grained behaviors and fine-grained affect and how that maps on to neural activity. So for the BRIGHT study, we recruited 159 mother-child dyads. About half of them were girls, and they were on average 24 months old, so they ranged from 1 to 3. The mothers and the children were videotaped while they engaged in a series of dyadic tasks. And during the dyadic play interactions, the mother and the children were assessed via NIRS. And I did this with 2 colleagues at Pitt, Ted Huppert and Hendrik Santosa. One thing I want to pause and say is that for the BRIGHT study, we only evaluated biological mothers and their children. However, I want to acknowledge that not everyone that gives birth identifies as a woman, and that there are various types of caregivers that exert a very important influence on children's lives, including fathers and non-biological parents. We started with biological mothers because we were interested in the role of maternal depression, which I will get into further on in the talk. But this is what the NIRS assessment looks like. So you can see them sitting together. They're looking at this brightly colored book together. We are able to have them each wear a cap that's getting the neural activity reading. And what they did was they did a series of tasks. They first looked at this brightly colored lift the flap book together. Then they did an age-appropriate puzzle together as an opportunity to do some interactive and cooperative toy play. And then they did a face-to-face interaction without toys. And we chose these types of interactions because they were typical things that caregivers and children do in the home environment. So it was most naturalistic to regular everyday life. We video recorded the interactions and coded them for mother and child emotion and behavior. And what we did when we coded them is we divided each video up into epics. Each epic was about 5 seconds long. And within those epics, we characterize periods in which the mothers and the children were matching each other on high positive affect, as you can see here. They matched on low positive affect, so they were showing similar levels of kind of neutral emotion. They had a mismatch where the mother was high and the child was low, or vice versa. So we had 4 different types of epics. And once we had that, we did a preliminary evaluation with the first 41 mother-child dyads, and about half of them, a little more than half of them girls, and again, they were about 24 months old. And although it was only 41 dyads, they provided over 1,500 epics of data, and we looked at this on the epic level. So we were looking at, in those moments when they were either matching on high positive affect, low positive affect, or had a mismatch, how does neural synchrony look? And we did publish these findings in 2023 in case you guys would like to look at it more closely. So in terms of our findings, we found what we expected. And I'll try not to get too deep into the details because I think the take-home message is actually quite simple and clear. And that is that in these moments in which the mother and the child showed similarly high levels of positive affect, but not when they matched on low PA, we saw greater neural synchrony between the mother and the child's medial frontal, lateral frontal, and temporal parietal regions. So over here in the image, this smaller circle represents the child's brain. This larger circle represents the mother's brain. And you can see that they're supposed to be looking at each other with their eyeballs and the nose. And each of these little gray lines are the channels that we can look at neural activity from. And the colored lines just represent significant associations between the child's brain and the mom's brain. And we're really seeing that synchronization was specific to when they were matching on high PA. There were no significant associations for the most part between mother and child brain activity when they matched on low PA or when there was a mismatch in positive affect. So what does this mean? During moments of high intensity positive affective matching, we think mothers are eliciting activity in mentalizing regions to understand what their child's feeling, and eliciting activity in regulatory regions to upregulate their own positive emotions and match their child's emotion as well. And we're, again, only seeing this during these high intensity positive emotional states when they match that way. So it's not just them being similar, because low PA matching was not related to neural synchrony. And what we think that is that this is another form of implicit emotion socialization that may reinforce activity in these neural regions involved in emotion regulation and mentalizing, leading to greater activity in these regions in the child over time, helping these children to elicit activity in these regions on their own over time if they continue to have these types of interactions with their caregiver. So that segues me to my next question, is why is this important? I hope I've convinced you what this positive biobehavioral synchrony looks like. And the next question is a so what question. So what? Is this helpful for kids? Does this help them thrive and grow? And the answer seems to be, from a host of systematic reviews that have been done in the past decade or so, is yes. When we look at synchrony of affect, behavior, and physiology, and a little bit of a review of neural synchrony, although that's much more in its infancy, so there's not as much to say about it so far. But on the whole, we see that caregiver-child positive biobehavioral synchrony is associated with a host of positive child outcomes: higher child emotional self-regulation, greater prosocial behavior, greater social emotional competence, and lower levels of internalizing and externalizing problems over time. So it's predicting these outcomes over the course of the next year or two when they're looking longitudinally in these studies. I'll walk you through 2 studies that provide this information in case that's helpful to give you a context of what they did to really identify that. So one study looked at slightly older children. These weren't young children, but they were 5 to 9. And there were 33 children and their parents engaged in a cooperative task. And what they found was that cooperation, higher levels of cooperation between the parent and the child during the task was associated with greater parent-child neural synchrony in the prefrontal cortex, again, this region involved in emotion regulation. And that same prefrontal cortex synchrony mediated the relationship between parent report of their own emotion regulation abilities and of the child's emotion regulation abilities. And so, what this group of researchers thought was that neural synchrony may be one picture of how the parent and the child are emotionally connecting with one another during a cooperative task. And that type of emotional connection may support the child's development of their own emotion regulation skills over time. In a different study, in which this group of researchers looked at 151 preschoolers and caregivers that engaged in a series of frustrative tasks as well as play tasks, they found that greater neural synchrony in the prefrontal cortex, but only during the play interactions, not during the frustration tasks, was associated with decreases in child internalizing symptoms over a 1.5 year period. And again, these findings demonstrate that caregiver-child positive biobehavioral synchrony, and again, I think context matters, is predictive of lower emotional problems in children over time. So if we understand what caregiver-child positive biobehavioral synchrony is and why it's important, the next question I think that's important to ask clinically is what could disrupt it? I think we would all agree here that for the most part, caregivers want to do the best for their children. We all want to provide a home environment and want to be able to interact with our children in a way that's going to help them thrive and develop and grow. But of course, certain factors get in the way of that. And understanding what those might be could help us determine how we can be of help. So some work has looked exactly at that. What are the factors that shape synchrony? So we know that caregiver-child synchrony seems to be higher in families with all of like the good things, families that are more cohesive in general, families where parents are more involved with their children. It also seems to be lower in families that are dealing with stress, so parenting-related stress and financial stress. But one factor that I've been really interested in is maternal depression. That's because it's so common. About 20% of mothers report experiencing depression at some point in their life, and it impacts the whole family system and not just the mothers themselves. By the very nature of the symptoms, the anhedonia, the low mood, the detachment, and the withdrawal, depression interferes with the way that we interact with others interpersonally, and that translates to the way that we interact with our children as well. And I doubt I have to convince anyone here that's listening to this talk that there's a wealth of research over decades showing that maternal depression is associated with compromised caregiving on average. Of course, there's a lot of variability and heterogeneity there, and I want to acknowledge that that's not always the case. In terms of synchrony in particular, though, there has been some work showing that maternal depression is associated with disruptions in affective and behavioral synchrony. That mothers who are coping with depression are more likely to match their young children's negative emotion expression and less likely to match their young children's positive emotion expressions. In fact, a study of my own that I conducted and published back in 2020, where I looked at preschool children and their mothers, we studied 72 mothers, 23 of which were currently depressed. And we had these mother preschool dyads engage in a positive emotional listening task in which they got to talk about a recent fun experience and plan the next time they would get to do it. We video recorded these interactions, and independent observers coded positive affect in the mother and the child separately. And what we found when we did these lagged models, basically when we looked at how mothers were responding to their children in the following epoch, we found that mothers who were currently depressed were less likely, to respond to their child's positive emotion. And also, if they did, they responded with less intense positive emotion relative to mothers who were not depressed. One thing to keep in mind with this result is that when we looked at mothers who had been depressed in the past, but were not currently depressed, we did not find this association. So that there is a lot of hope in that when mothers recover from depression, a lot of these synchrony related disruptions seem to improve. And there's more and more research showing that effect as well, which I think is a good news story for for mothers that are dealing with depression. So with this affective synchrony data in mind, I wanted to do some additional analyses from the BRIGHT study to look at neural synchrony. So in addition to those 41 mothers who had been in the prior analysis, we recruited more mothers, and we had 100 dyads in this analysis who had usable neural synchrony data. 61 of these mothers had no prior psychiatric history. 39 of them were clinically depressed. And again, this is the same study, so they did the same dyadic play task with simultaneous NIRS. We measured maternal depression using an interview that's widely used in research, the SCID interview, and a widely used questionnaire measure as well, the CESD. And my question was, does maternal depression disrupt neural synchrony? And what we found was in this blue line, a negative association between maternal depression and neural synchrony. So higher levels of maternal depressive symptoms on that questionnaire measure were associated with lower neural synchrony between the mother's anterior medial prefrontal cortex, this region here that's involved in emotion generation, including positive emotion expression, and the child's left TPJ, a region involved in mentalizing. And so we did find some evidence that, yes, depression seems to be disrupting the ways in which the mothers and the children are responding to each other in the moment in these regulatory and mentalizing regions. Interestingly, the same neural synchrony pattern was associated with higher child internalizing symptoms a year later. So we're seeing higher maternal depressive symptoms, lower neural synchrony, and that lower neural synchrony is related to more internalizing problems in the child 1 year later. So the take-home message from this preliminary result is that depression-related disruptions in neural synchrony during positive interactions, because all of these tasks were positive play tasks, seem to be associated with elevated child emotional problems. Now, you may see this red line here, and that red line is actually a positive association. That's not what we expected to find, is that in the case of this region, there was an association between the maternal depression and greater neural synchrony. And so it made me wonder what's going on there. Are there some factors that could moderate the way that maternal depression relates to neural synchrony? And by moderate, I mean, does it depend on other factors that are going on in the home or other factors that could be part of the way that the caregiver responds to their child? And so again, I went back to this coded affect data that really has provided like a rich picture as to what's going on in these caregiver-child dyads. In this case, we limited our analyses to just the moments in which the child was showing positive affect. And we looked at in the next epoch, did the mother respond with positive affect herself, or does she not respond in kind, as a measure of maternal positive affect responsiveness or affective synchrony. And what we found was what you might expect. Maternal depression was associated with lower neural synchrony only when responsiveness was low. So this red line here is this negative association between maternal depression and neural synchrony. When when positive affective synchrony was high, the association, this green line, was actually not significant. So we're only seeing maternal depression to be related to lower neural synchrony when affective synchrony is low. So similar to synchrony of physiology, we're seeing the synchrony of neural systems that are occurring in moments of positive affect and behavioral synchrony. We're seeing that there's some depression-related disruptions in neural synchrony that may be mitigated by helping caregivers learn to respond to their children's positive emotions and behaviors. And this is a good news story because affective and behavioral synchrony is trainable. We can teach caregivers how to notice, identify, acknowledge their child's positive emotions, and how to match that. And what that might do is that it might mitigate some of this physiological coupling and neurological neural coupling that's happening that could lead to mutual dysregulation or poor outcomes in children. I noted at the beginning of the talk about this focus on mothers, but there are people that are doing a lot of good work about fathers and neural synchrony, including my postdoctoral researcher, Lindsay Terabin. So I want to put a plug for her here. She's starting her own project soon where she'll be looking at fathers and neural synchrony, understanding that they also play a unique and impactful influence on child socio-emotional development. Some work that's been done in the past 5 years from some other researchers has shown that father-child cooperative behavior is associated with neural synchrony in young children. Although there is one study that I have here that did show that mothers did have higher neural synchrony and behavioral synchrony compared to dads. So I think there's still a lot for us to learn in terms of how different caregivers or different factors might influence affective, behavioral, and neural synchrony in young children. The last thing I want to touch on before we open up for discussion is a newer study that we've started. We're still in recruitment, and it's called the PAIR study. It stands for Postpartum Affect and Infant Mother Regulation. We're going to recruit 260 dyads that'll be enriched for postpartum depression. So about 75% of the mothers will meet criteria for postpartum depression. We've already recruited 160 dyads, so we're well over halfway there. And we are following up these dyads over the course of the postpartum period, doing a lot of the same things we did in the BRIGHT study, where we'll be video recording them interacting with one another while they are assessed for neural activity using NIRS. But what I'm really excited about with the study is that we're using a portable NIRS system that allows us to take this study right into the home. So this is kind of what it looks like. We are able to set up our equipment anywhere in the home that the mother feels is comfortable with us having us. The system is super lightweight. It's just about this big. It looks like a little Nintendo Wii, if you guys know what that looks like. So we can carry it with us, as well as some portable video cameras. And doing it in the home has a number of advantages. Number one is that it reduces participant burden. So these are postpartum mothers who at the beginning of the study, their baby's about 3 months old. So as you can imagine, or as you may have experienced yourself, it's a lot of work getting your baby and all of the baby care up out of the house and to the lab. And it's a barrier to participation for a lot of mothers to do that at this stage of the postpartum, especially if the mother's dealing with depression herself. So it really increases accessibility. The other advantage of that is that the data is more ecologically valid. We're really interested in how caregivers and their infants and young children are responding to one another, and where better to do that than in the home itself. So we're able to allow them to interact with one another in the setting where they normally do that versus an artificial lab environment where maybe mothers and babies might be more on edge. We are doing this using a face-to-face play task where we watch them play before and after an interpersonal stressor. So we're really able to look at neural synchrony across various contexts. And what we've done when looking at the initial 63 mothers and their 3-month-old infants, about 38% of the babies female, is we looked at a questionnaire measure that we had the mothers fill out where she rated how much the statements sounded true for her. So statements like, I'm a good mother, and my baby and I understand each other. So a measure of confidence in her parenting. And we found that greater maternal confidence was associated with stronger coupling of maternal and infant prefrontal cortex activity. So again, these color red lines. Obviously, we have a lot more to do with the PAIR study. I just really wanted to give you guys a quick early peek with that, but wanting to see how that postpartum depression might impact confidence and neural synchrony down the line is our plan. In sum, across the talk, I hope I've convinced you guys that caregiver-child positive biobehavioral synchrony is a developmental mechanism that supports healthy child socio-emotional competence, that outwardly we can observe that as shared and responsive positive affect, gaze, and vocalization, as well as coupling of physiology and neural activity. It seems like it's really important, especially for families dealing with stress or psychopathology, such as maternal depression. And this is a good news story that we can train this. We can help caregivers learn how to respond to their children in a sensitive and positive way, and how to couple with their child's physiology and neural activity in the course of positive contexts, which might be really important for resilience and recovery. Clinically, I think there's a lot for us to learn. I think we could tailor interventions to try that provide this training. And I want to give a little plug for one therapy in particular that I've learned about recently, the parent-child interaction therapy, emotion development adaptation that was created by Joan Luby and colleagues at Washington University, where in addition to the standard components of PCIT, they're training parents specifically on supportive emotion socialization skills, trying to provide those parents with these skills that could be helpful for their child's early emotional development. I want to acknowledge all the mentors and collaborators I've had along the way that have helped me with this work, as well as my past and present trainees and staff, and also thank all of you guys for your time and attention.